All right, so here we are looking at some type of proliferation within the dermis. You can see that there are a little bit of eccentric aspects to the tumor here, and then there's kind of a central aspect. Again, here's another peripheral aspect, and then moving on to another section, you can see it's kind of more well contained in this section, so it looks to be some type of proliferation that's not too poorly circumscribed. It's kind of located in the central part of the biopsy. We go on higher power and we start to see what looks to be a vascular proliferation. You can see some areas of what appear to be lumen. There are some papillary projections of this neoplasm into larger spaces, and then there's some kind of more solid areas of the tumor as well. You go on higher power and you'll start to notice, again, that really prominent papillation of the tumor. Of course, we're always looking to make sure that these endothelial cells are not too atypical, and actually they look pretty homogeneous, pretty bland. Interestingly, though, this particular vascular neoplasm has a lot of these eosinophilic inclusions here spread throughout the stroma and between, and getting a little bit close even to the lumen here. So you'll notice there's quite a bit of these eosinophilic inclusions here. I hope you'll appreciate just a few examples of those here. And they're different than the erythrocytes, actually, which you'll be able to appreciate within the lumen. So these eosinophilic inclusions are kind of more separated back into the stroma in many of these areas. And so just kind of scrolling around to show you more examples of that. And one particular area had a nice mix of a solid component of this, what I'm going to call hemangioma. And you can see this kind of plump endothelial architecture. Again, more of those eosinophilic droplets. And there's been some studies to kind of figure out what this is. It may be some type of basement membrane component here. You can see them nicely here. So overall, putting these features together with the circumscription or the relatively well circumscribed nature, it doesn't look like it's a malignant vascular neoplasm, with some areas that look like they're forming renal glomeruli. So you could definitely think about a glomeruloid hemangioma here. There is a related entity that looks very similar, called a papillary hemangioma. And there's a little bit of a debate in the literature as to whether or not these are related or they're completely separate entities. Depends on which paper you read. I will say that the eosinophilic droplets have been cited in both the papillary hemangiomas and the glomeruloid hemangiomas. I think that the most important thing for you to know is that when you say glomeruloid hemangioma, you often trigger the association of Poem syndrome. And Poem syndrome, the S stands for skin abnormalities. So often they'll have these glomeruloid hemangiomas present on the skin. But the rest of the Poem syndrome acronym stands for P is polyneuropathy, O is organomegaly, E is endocrinopathy, which many times the sex hormones will be affected. M is monoclonal gammopathy, and then S is skin abnormalities, and oftentimes you'll have these hemangiomas. So this is actually a hemangioma with features of glomeruloid hemangioma. You could also make the argument that this is a papillary hemangioma as well. The most important thing is to make sure there's no clinical association with Poem syndrome, and just to make sure it's a standalone hemangioma in and of itself. This particular lesion appears to involve the base of the specimen, so it could recur. And if there's additional recurrence, complete but conservative excision would be recommended, just to make sure there are no additional features that are not represented in this specimen.